Hello juniors, so I welcome you all again in the continued series of upper limb, and today we are going to cover an important topic which is the breast. In today's module we will be covering its introduction, though this topic don't need any introduction. Still we are going to cover its introduction from anatomy point of view, its extent, deep relation and the structures of breast. So without wasting further any time, let's move ahead. So starting with its basic introduction, breasts are prominent in females and rudimentary in males, underdeveloped in males, and also in females they developed after puberty under the influence of female hormones, female sex hormones like estrogen and progesterone. Breasts are accessory organs of the female reproductive system which produce milk and provide nutrition to the newborn. Breasts can be of different shape, sizes, which can be hemispherical, conical, piriform, pendulous or flat. Anatomically, breasts are divided into four quadrants which are upper lateral, upper medial, lower lateral and lower medial. So here I have summarized all the points, and anatomically our breast is divided into four quadrants which are upper lateral, upper medial, lower lateral, lower medial. Just like we have four chambers of the heart, the breast is divided into four quadrants. So coming to the extent, breast lies on superficial fascia. So what is a fascia? So by the way of review, fascia is a sheet or band of fibrous connective tissue which separates or bind together muscles, organs and other soft structures of the body. It provides internal structure and support. So if you haven't watched my video on fascia or clavipectoral fascia, just go through it and you will be able to better understand the superficial fascia. So right here, if we assume this is our fascia, this is our superficial fascia, all here. So over this superficial fascia lies our breast. Secondly, a small extension of the upper lateral quadrant called the axillary tail of Spence. So what is this? This is a small extension. This small extension of the fatty tissue of the breast, it extends from the upper lateral quadrant. This is our upper lateral quadrant. It extends and is known as the axillary tail of Spence. Clearing away my ink for you. Vertically, the breast extends from second to sixth rib. This is our first rib. This is our first rib and this is our sixth rib. So vertically it extends from second rib to the sixth rib, and horizontally it extends from lateral border of sternum. This is our sternum bone. It extends from lateral border of sternum to the mid-axillary line. This is our axilla to the mid-axillary line. Up till here, more or less, the breast extends from these two corners. Again, the point to note here is, which is commonly required in the clinical practicals, is the situation of nipple. So the nipple is present in fourth intercostal space. Showing you the fourth intercostal space. This is our first rib and this is our first intercostal space, second, third and fourth. So the ribs goes like this. So this is our fourth intercostal space. More or less the nipples are present in the fourth intercostal space. Now coming to the deep relations. So what comes under the deep relation is the structures over which our breast lies. So, or the structure which are beneath the breast. So as I've already told you, breast lies on the pectoral fascia or superficial fascia, and deeper to fascia lies the three muscles which are pectoralis major, serratus anterior, and external oblique muscle. We'll able to appreciate this with the help of this diagram. This is our pectoralis major muscle. Downwards I have external oblique muscle. We'll cover this muscle under the topic of abdomen, and lastly I have serratus anterior muscle. So these three muscles lies deep to the fascia, and with the help of another diagram right here you will able to appreciate it. So this is the cross section of breast, and we are viewing from the lateral view. I've showed you the whole, and we have taken the cross section and viewing from the lateral side. Here the breast lies on this fascia, this white colored fibrous band which is our pectoral or superficial fascia, and under this pectoral fascia we have three muscles which are pectoralis major muscle, serratus anterior, and external oblique muscle of abdomen. This is our external oblique muscle. This is the pectoralis major muscle, and under the pectoralis major lies the serratus anterior muscle. So coming to the structures of the breast. So for understanding the structure of the breast, I want you to remember this vehicle. And now you must be wondering why sir is showing his fake and ugly Ferrari, Rolls-Royce, Maybach 911. So first of all, this car is sponsored by my channel ASAT MBBS, so this is none of your business. And to remember for the sake of simplicity, to remember the structure of breast, I have taken the analogy of this car, and you have to remember this car under three headings, which are its color, its engine, and its chassis, or we can say framework. So here the color of the car represents the skin, engine represents the parenchyma, and chassis represents the stroma. I'll tell you all this in a minute. So to understand the structure of the breast, so chiefly the breast is divided into three structures, which are skin, parenchyma, and stroma. So what is the skin? Skin covers the gland and present features like nipple and areola. Nipple is pierced by 15 to 20 lactiferous duct and also rich in nerve supply. Areola is rich in areolar gland, which becomes enlarged in pregnancy and lactation to form raised tubercle of Montgomery. I'll show you the picture of this in a minute. So this is the skin. This is the skin which presents with features like nipple. This is the nipple, and this is the areola. This darkened skin is the areola, and the nipple is pierced by 15 to 20 lactiferous ducts. So these are lactiferous duct, which drains the milk from these mammary glands. So nipple is pierced by 15 to 20 lactiferous duct, and the nipple is rich in nerve supply, therefore it is very sensitive to touch and stimuli. And in pregnancy and lactation, the areolar gland and nipple, they proliferate to, or they becomes enlarged to form tubercle of Montgomery. These are tubercles of Montgomery, these small and enlarged glands. So the way we can relate the skin to our analogy with the car is, now I'll rub this color of the car. So the color represents the skin of our tissue, which was red color of the car represents the skin of the breast. Now coming to the second part, which is parenchyma. Here you must have remembered the parenchyma. We have told you it is analogous to engine. So what is engine? So engine is the basic unit of a car. So without any engine, the car won't work. So engine is basic unit, and we can say it is a parent unit of a car. So without engine, the car won't work. So what is parenchyma? Structural and functional unit of tissue. And the way I used to remember parent is parent unit of tissue. So in this case of breast, the parent unit of tissue is our mammary glands, which produces milk. So mammary gland represents the parenchyma of the breast. And to relate this with the help of our analogy, the parenchyma is the engine of the car, or the parent unit of the car, which are the mammary gland. So parenchyma, which is the mammary gland consists of 15 to 20 lobes. Each lobe has a cluster of lobules or alveoli and drained by lactiferous duct. Near termination, each duct has a dilatation called lactiferous sinus. As I've told you earlier, these are the mammary lobes. These are parent tissue of the breast. These lobes, these are 15 to 20 lobes in each breast, and these lobes are further divided into lobules or alveoli. So these for this is the schematic diagram, and this is a single lobe, and each breast has 15 to 20 lobes, and each lobe is further divided into lobules or alveoli, which are drained by lactiferous duct. So this is the lactiferous duct which drains the alveoli. So now near the termination of lactiferous duct, these ducts dilate to form a lactiferous sinus, and these ducts, which I have already told you, they pierce the nipple. So coming once again back to our analogy, was that my red color car, here the color of the car represents the skin, engine of the car represents the parenchyma, which is the parent unit of the car, and lastly the chassis or framework, which represents the stroma. So for once I have this engine and all the supporting structure which I am highlighting, these are the chassis or framework, steel framework of the car, without which the engine won't be functional as well. So these framework represent, or chassis represent, the stroma. So coming to the stroma, stroma corresponds to the connective tissue, which are fat, fiber, ligaments. So originally this is the structure of the breast, this is the cross section, and we are viewing from lateral side. So these are the parent unit or mammary glands of the breast, and all this rest supporting structure, which is this fat or fiber, ligaments, all that supporting structure comes under the category of stroma. Fatty stroma forms the main bulk of the gland and distributed everywhere except beneath areola and nipple. So what he is saying is the fat is present all over the gland except beneath the nipple and areola. And stroma anchors the gland, as I have told you, with the help of the analogy of the car, that supporting framework or chassis forms the stroma. It anchors the whole structure of the gland. So coming back to this diagram, clearing away my ink for you. All these were our mammary gland. These all were our mammary gland, and rest of the structure, which are this fatty tissue, this fiber or ligaments, rest all these forms the structure, stroma of the breast. So a term to remember is suspensory retinaculum of Cooper's. So what is this Cooper's ligament? Cooper's ligament is a retinaculum or network of ligament which provide the structural support to the breast.